The United States is cutting PEPFAR funding. And if you or someone you know relies on HIV treatment, basic medical care, or maternal care, this is big news. And this can change healthcare in Nigeria forever. So, what does this mean for Nigerians? And most importantly, what can we do about it? So, if you or someone you know relies on the aforementioned treatments, stay with me to the end of this video so we can break it all down in simple terms and what you can do to take the necessary steps to protect yourself and your loved ones.
Your love is rated X. That means you're
Good day,
extra.
warriors. You're welcome back to the channel. It's your favorite white coat warrior, Dr. K. And today we're going to get into PEPFAR and why it is important and what it means if they cut its funding. Before we start, let me just let you know, if you're new to the channel, please hit the subscribe button, become a warrior today. It's fun on this side. So now, what is PEPFAR and why is it important? PEPFAR stands for the President's Emergency Plan for AIDS Relief. So this was set up by the US government in 2003, and it has been responsible for funding millions or billions of dollars for HIV treatment and prevention, and Nigeria was one of its biggest beneficiaries. It has been, because of PEPFAR's funding, numerous antiretroviral drugs and numerous antiretroviral therapies have been funded by the United States, and people have been able to access these drugs for free. It has been responsible for HIV prevention, maternal health care, and also it has even helped in some medical training. To put this into perspective, more than 90% of HIV treatment has been due to PEPFAR funding. So if this funding is cut, that means millions of lives are going to be affected. So why is PEPFAR funding being cut? Some US lawmakers have been raising concerns and questions, trying to understand or about how the funds are being used. Aside that, foreign aid, there's gradually been a decline in foreign aid budgets. Also, there's just been a shift in priorities. So I don't really think this is about politics alone. This isn't just about politics, because this decision is actually going to affect the lives of millions of Nigerians. So now, what does this mean for Nigerians? So there's going to be drug shortages. Nigerians may struggle to access free or at least affordable HIV treatment. There's going to be increased HIV transmission, of course. There's going to be a strained healthcare system. The public health system in Nigeria is already under immense pressure, and following this decision and the cutting of PEPFAR funding is going to make situations even worse. And it's also going to be important to note that there's going to be higher treatment costs. So Nigerians who initially had these drugs accessible for free are now going to have to pay out of pocket and in full to access these necessary treatments. So what can Nigerians now do? Definitely this sounds scary, it is a scary situation, but there are steps that we can take in order to, kind of curb or at least soften the blow a little bit. Number one, know your status. Get tested. Know the status of the people that you are sexually involved with, preferably before you engage in any form of sexual interaction. So this is very important because this can just help you, like early detection does save lives, and prevention is the best cure, as they say. Make use of condoms. This can serve as a barrier to at least prevent the transmission of the virus that causes this disease, and it's quite affordable, and it's just another means to still engage, for those who are sexually active at least, to also partake in safe sexual intercourse. It's important to secure your HIV treatment. For those who are already on HIV medications, speak with your doctor to just seek out alternative options. You can explore local health programs. This will just help, or at least hopefully the local government or the government in general, as well as private organizations, may take up new initiatives in the face of this new in the face of this situation that we are currently in. Advocacy and and understand, if we advocate and we stay informed, this can actually push policymakers to, make decisions, make changes, take up new initiatives. Also, it's important that we should consider affordable health insurance. You can look into the National Health Insurance Scheme or private plans for long-term security. Last but not the least, Nigerians are quite resilient, and I do believe that by the grace of God we will find a solution, but we just need to demand accountability and take charge of our own health. So now we have come to the end of this video. Let me know in the comments, do you think Nigeria is ready to handle this crisis without PEPFAR? Do you think that we can be able to the government to be able to take up new initiatives to actually help in the future to combat this situation? So let's keep the comments going. Let's keep the comment section active. Let's say a word or two. And I do pray that everything would at least we'll find a suitable solution before things get too drastic in the future. So thank you for staying to the end of this video. If you're a new warrior, once again, please like this video and become a warrior today. Hit the subscribe button. So that's all I have to say on my end. Please stay informed and stay curious. Thank you very much, warriors. Have a wonderful week ahead. Bye.